Welcome to Medica Nova Wellness Studio. I'm Dr. Angelika Maria Koch with the educational videos about optimal health and the most innovative and holistic approach to your well-being. Lately I got quite a few inquiries from my YouTube audience, so thank you very much for participating here, about glaucoma and if there are any natural and effective treatments available. Well, the answer is yes, but with glaucoma you won't find a straightforward one-fits-for-all prescription, as it requires an overall treatment protocol as well as medical treatments. So enjoy this video. To stay updated with my ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and family, and don't forget to click that bell as it notifies you every time I upload a new video. And if you're interested in learning about homeopathy, integrated mental health, health coaching, quantum healing and so much more, have a look at my website medicanova.net at the online academy, where you will find comprehensive certified home study online courses. And if you're interested in a personal health consultation, either for yourself or your children, contact me at health@medicanova.net. I'm happy to help. So what is glaucoma? Well, next to macular degeneration, glaucoma is one of the leading causes of visual impairment as well as severe irreversible blindness in the world. In the US, we see about 3 million people affected. Globally, there's an estimate about 5.7 million people. People, over 60 years old are more at risk, as well as African Americans. Left untreated, glaucoma can cause blindness, and sadly about 10% of the people who are actually receiving proper treatment still will develop irreversible vision loss. Now, medical treatment is essential here to prevent further damage from glaucoma, but there are also certain foods, supplement and homeopathic remedy that can help to improve the symptoms and fight the eye damage. So what are the causes? Well, glaucoma is really the result of a damage to the optic nerve. And as this nerve gradually deteriorates, you maybe feel or see blind spots developing in your visual field. For reasons that doctors really don't fully understand, the nerve damage is usually related to the increased pressure in the eye. And that's the keynote here. So this elevated eye pressure is due to a buildup of fluid, and we call it aqueous humor, that flows through the eye. Now this fluid normally drains into the front of the eye, we call it the anterior chamber, through a tissue called trabecular meshwork. It's like a sieve at the angle where the iris and the cornea meet. Now when the fluid is overproduced or the drainage is not functioning properly, it's blocked, it's like your bathtub drainage is blocked, so to say, the fluid can't flow out at its normal rate and the pressure builds up. Now the cause is therefore the accumulation of waste products, and that can be related to aging, to high blood pressure, prescription drug, eye injury or other eye-related diseases. Glaucoma also tends to run in the family, and some scientists have identified even some genes which are related to high eye pressure and optic nerve damage. There are several types of glaucoma, so I want to give you just an overall overview here and a bit of an understanding before we go into our natural protocols. The most common types are called open angle and angle closure glaucoma. Both involve an increase of the intraocular pressure within the eye. So with the open angle glaucoma, the drainage angle formed by the cornea and the iris remains open, that's why it's called open, but the trabecular meshwork is partially blocked. So this causes pressure in the eye to gradually increase, and this pressure also damages the optic nerve. It happens very slowly that you may even lose vision before you're even aware of the whole problem, and that's really the downside of glaucoma, that for years you don't know, that's really what's happening. The next one is called angle closure glaucoma, and it's called because the iris bulges now forward to narrow or block the drainage angle formed by the cornea and the iris. And as a result, the fluid can't circulate through the eye and the pressure increases. So some people have narrow drainage angles. They also get more or lean more with an increased risk to angle closure glaucoma. Angular closure glaucoma can actually happen quite suddenly. We call it acute angle closure glaucoma, or even gradually also, and then we call it chronic angle closure glaucoma. Acute angle glaucoma is a medical emergency. Often the pupils dilate very fast and you need to go to a hospital immediately. And then we have normal tension glaucoma. Think like, what is this name? Normal tension. It's either tension or not, tension. But in normal tension glaucoma, your optic nerve becomes damaged even though your eye pressure is within the normal range. It gives it away. So no one knows actually exactly the reason for it, but here you may be sensitive, in general, sensitive optic nerve, or you may have less blood flow being supplied to your optic nerve, and this limited blood flow could be caused by atherosclerosis. These are fatty deposits, right, plaques in the arteries, and therefore, an impairment of the general circulation to your eye. You also see glaucoma in children, and even infants, can be present at birth or develop in the first few years. The optic nerve damage here may be caused again by drainage blockages or an underlying medical condition. And the last one is called pigmentary glaucoma, and as the name said, it's like pigment granules from your iris build up in the drainage channels and therefore blocking the fluid exiting your eye. Now the activities can be exaggerated, by jogging. Athletes, you see that more because it stirs up the pigment granules. They deposit them in this trabecular meshwork and causing this intermittent pressure elevation. So what are the symptoms? Well, it's not so easy with the symptoms. It really depends on the development and the progression of the glaucoma. But open angle glaucoma, you often see these patchy blind spots in your side, the peripheral, as well as the central vision. Frequently there can be tunnel vision, in advanced stages. And with open angle or chronic glaucoma, there's no pain with increased eye pressure. For some people, it's hard to even notice, right, the peripheral or side vision loss, till it progresses really stronger. With the acute angle closure glaucoma, you have more headaches. There can be eye pain, there can be nausea, there can be vomiting, blurred vision, there can be halo around a light, eye redness, and of course that needs to go to the hospital right away. Because, there aren't any sort of obvious glaucoma symptoms in the beginning, it's really important that you have your regular routine eye exams. Your doctor will measure the intraocular pressure, test for optic nerve damage, check for vision loss, measure your corneal thickness, and inspect the angle of drainage if there's any blockage there. So this is really important. So what are the conventional treatments? Well, usually it starts with prescription eye drops, and they often contain prostaglandin or even beta blockers to sort of reduce this pressure as well as sort of just trying to open up the channels. And if that doesn't work, then we have laser and surgery again to remove the clogged channels. I want to give you some food for thought before we go into the natural protocols. Again, I started this recently. I want to just give you also a bit of a different story about what a physical symptom might express. And according to Jacques Martel's book, which is great, it's called The Complete Dictionary of Ailments and Diseases, glaucoma involves a blocking of the eye's drainage canal, which we have established, thereby preventing the inner fluid from being released and causing a buildup of internal pressure. Now, he refers not to the text in his first person. So, it feels like, maybe that applies to me as well. So he says this liquid represents all the tears that should have flowed throughout my whole life, and which, having accumulated, bring increased pressure to bear on the retina, thus causing my eyesight to deteriorate. It affects more frequently people over age 60 who often feel that they have seen enough. It may be the sign of old resentments and a refusal to forgive. It may feel overwhelmed and submerged by life, and I fear the future. As I feel easily fatigued, life becomes different and more difficult to accept. Emotionally, I refuse to see myself getting older. I can't see any sort of images of the future, and that suits me actually quite perfectly. As an eye, is affected by glaucoma, it reacts like a magnifying glass. There's something or someone in my life that I want to get closer to as fast as possible, toward whom I want to move. It may be in terms of time or space. It is as if I was too late. The goal is so close, but I sense a danger pursuing me. Glaucoma also, compels me to look. I can only look forward and not laterally, as if I was wearing horse blinders. Right? That's when we talk about the tunnel vision. I have the impression that I missed or passed up certain things in my life, and I feel resentful about them. It is as if opportunities are slipping through my fingers just when I'm about to obtain or accomplish something. I feel myself as in a tunnel, with life passing through at full speed. My life is gloomy, full of melancholy and misery, and he goes on, but I just want to give you a short overview about it, right? What causes you in your life to, experience life with a tunnel vision, right? That you see sort of blind spots in your vision, in the peripheral vision as well as in the central vision. What blocks you to see clearly? He says the positive affirmation would be, I accept to remove the veil and to see with love and tenderness. I stop clinging to others and live the present moment intensely. I forgive and I accept to see life more tolerantly. So I just wanted to give you some food for thought about it, because, in my practice, there's no way I cannot say that there isn't a link between the mental, emotional, and life experience and the individual expression of symptomatology. So what are the natural protocols? So as you get the idea that the eye is weakened, there's a blockage going on with the fluid, cannot release itself, that we need something more powerful, right? Like a drainage blocker, something really so powerful that these waste products just dissolve. And one of the substances in our bodies are called antioxidants, which actually can do that. So you would need a lot of antioxidants. So we're going to start with antioxidant food, right? And antioxidants are there because they fight the free radicals, which are the baddies in our bodies. And, they get quenched by this amount of antioxidants. So we want to have that because they damage the eyes and worsen the situation. So I want you to consume lots of veggies and fruits with orange and yellow colors. You also want to bring in Brewer's yeast. It's the chromium present in Brewer's yeast that has been shown to benefit people with glaucoma. And you want to bring in bilberry. It's a fantastic plant. It contains a number of phenolic compounds, flavonoids, quercetin, phenolic acids, but also anthocyanin. It's a powerful antioxidant that has been shown to enhance the health and the vision. Now, another one, great antioxidant is called Astaxanthin. It's a very potent carotenoid, and Here again, it can help prevent retinal damage. It's found naturally in red, orange colored foods like algae. Salmon is also full of it. And it's also available, of course, in supplement form. Here, I would like you to add it in supplement form. It can also help to protect your eyes from retinal cell damage that's caused by this oxidative stress. That's where we have the antioxidants quenching the free radicals and reduces ocular inflammation. We want to bring in a lot of omega-3 oils, in this case fish oil. Studies indicate that fish oil has been shown to reverse age-related eye disorders. There was even a study published in the International Journal of Ophthalmology suggests that cod liver oil as a combination with vitamin A and omega-3 fatty acid is beneficial for the treatment of glaucoma because it decreases the intraocular pressure, increases ocular blood flow, improves optic neuroprotective function, and prevents oxidative damage that contributes to the progression of glaucoma. And another antioxidant, I think in general, anybody, between the age 50, 60 and above should take CQ10. It really is a great preventative for free radical damage here, and especially to the eyes. We also want to relax the blood vessels in general and improve the blood flow, and here I would say magnesium would be very beneficial. I like a product. I'm not getting any benefits from it by mentioning. I'm not affiliated with the company, but there's a product I like. It's called Dr. Whitaker. He has a product called Ocular Pressure and Retina Defense Supplement. Would really advise that. He also is very specified with macular degeneration. It's called Ocular Pressure and Retina Defense Supplement. Avoid any processed food, especially alcohol, caffeine, excess sugar, because it adds to the heightened pressure of your eyes. Glaucoma is a serious condition, right? It affects your eyes and your vision. It needs to be treated medically immediately after diagnosis. But although these natural remedies have proven, which I'm going to share with you also with the homeopathic remedies, are beneficial in studies, it is essential that you really contact your healthcare provider, because we don't want to have permanent vision loss here. So let's go for the homeopathic remedies. I think the combination here is vital, and I personally in my practice had good success. That's why I want to share with you my findings and what I use in my practice. The idea is that we look for the individual key symptoms of your expression of glaucoma, because you're unique. Your symptomatology is very different from your next one who also maybe experienced glaucoma, and then match the remedy which has the similar expression with your symptoms, and then homeopathy is very helpful here. Now usually I in my past videos only share with you remedies which you can get hold of in your local health food store. Well, in this video I will also share with you some remedies which you can order online, and I will point that out. So as I said, I would use the potency 30, that's the over-the-counter potency. Take one tablet, for 3 to 4 weeks, and then check it back with your ophthalmologist to see if the pressure reference has been reduced, right? So don't play around with it. Of course, always contact your healthcare practitioner or me at Medica Nova. As I said, I'm happy to set up a health consultation with you and see what I can do. But the first remedy which I had really good success is called Phosphorus, and you will get that in your health food store. It's one of the top remedies indicated for glaucoma. And here it's also specified when the optic nerve is already damaged or atrophied. It means it got just thinner and smaller, shriveled. So the main symptom guiding the use of this homeopathic remedy is there is a constant tiredness of your eyes all the time. The eyes seem very tired even when they're not engaged in much work. The eyes seem to be exhausted. And along with this fatigue of the eyes, the vision is blurred and the patient feels that every object is under cover of dust or a veil. And every time she looks at it, there can be even halos around the light, and it's a very important symptom here. Another key symptom is, when they put the hand on the eye and sort of shading the eye a little bit, suddenly the vision gets a bit better. So by doing this, the objects that look blurred seem somewhat clear. So the keynote is fatigue. And about 3 weeks ago, I had a patient who was fearing that she, moves into glaucoma because she experienced a sort of a really large black dot in the visual center of her eye, progressively got worse in size, and I prescribed Phosphorus 30 on a daily basis for some time, and she sends me now little pictures of the reduced size of the black spots. So she's very happy because she doesn't want to have surgery. Another patient I remember recently, she is a diabetic, very strong experience of flashes, again these black spots in the visual periphery, and really was, to the point that she couldn't drive her car anymore. She was very alarmed, and Phosphorus helped her dramatically. They actually stopped completely. So as well, on top of it, that her diabetic markers went down, so there's a clear relationship to it. The next remedy is called Comocladia, and that is a remedy you will not find in your health food store. You maybe have to order that online. The specific symptom here is that there is a lot of fullness, a sensation of fullness in the eye, and the fullness is mostly accompanied by a pain in the eyes. Phosphorus doesn't have pain, but Comocladia does have, and the eyes feel very enlarged. The eye pain gets worse by warmth, so the people feel better in open air, coolness, but there's this fullness in the eye. We talked about this acute situation of the glaucoma. Again here, the remedy would be Belladonna 30, and the main symptom is when you have sudden increase dimness of your vision, your eyes appear red, severe pain in the eyes as well as headache, and the pain is so violent in character that you maybe have nausea and vomiting with it. Right, that's the angle closure glaucoma, when it gets really, really acute. Of course, you go to the hospital by then. 2 other remedies which you maybe want to order online, which if they fit your description, one is called Osmium 30. Again, it helps in improving dim vision. In here, the intraocular pressure is raised in person needing the Osmium remedy. And the important symptom listed by the patient is display of various changeable colors. So here we have this iridescent vision. So when you look at an object, you have different angles and different rainbow colors coming up. That's osmium. They also have definitely an intolerance to light in general. So if you see colors, iridescent colors, then osmium would be more indicated. If there's an eye injury and then it is caused, the glaucoma is caused by eye injury, it's Physostigma 30. It's, the vision becomes blurry, there's partial blindness, pain in the eyes, but usually it's related to an injury. Then the next remedy is Colosynthesis, and that is a remedy which also is related to irritable bowel syndrome, for example. Right? If you have colics on a regular basis, where the indication is where you press in there and the heart pressure is actually better for the IBS, but it's also indicated for glaucoma. And what we have here is there's a sensation as if the eyeball would fall out. There's a lot of pain in the eyeballs when the pain travels to the head and is better by pressure. Better by pressure in general throughout the whole body. That's why the IBS is better when you sort of press your hand against the colon. It's a good palliative. But as I said, you need some professional help here. I just want to bring in 2 more remedies because glaucoma can be also at different sides of the eye, right? Either on the left or the right. So if you have a right-sided glaucoma only, it's Prunus Spinosa 30. Great remedy here against sudden pain in the right eye. Prunus Spinosa works mainly for the right eye pain. And it's very acute, violent, and almost results in a bursting sensation in the eyeball, right? So it's a little bit similar to the Como Claudia, but there's more fullness. Whereas with Prunus Spinosa, you have a lot of bursting sensation, right? It's really sort of like pushing out. And then on the left eye, it's Cedron. Cedron is a wonderful remedy where you have, again, violent pain in the eye, especially the left eye. And the onset of pain may show certain a periodicity. That means it's not every day, but every 2 weeks or every 10 days. It's very specific for Cedron. And the pain may show radiation to the nose. So I think this is what I want to keep it today. I know homeopathy, of course, offers many more indicated remedies for glaucoma, but this video serves more as an inspiration as well for educational purposes only. So even if you have been diagnosed with glaucoma, it is worthwhile trying the combination of natural supplements and homeopathic remedies. And as already mentioned, glaucoma is a serious ailment and requires medical treatment as well as your natural and therapeutic intervention and help. If you need more help, contact me at health@medicanova.net, your local health practitioner, and I wish you all the best. For today, much love, take care.